My dear viewers, we have Dr. Sridevi with us. Sleep is very, very important, especially during pregnancy. Can you, Dr. Sridevi, share about sleep to our audience?
Yeah, thank you. So sleep, usually in the first trimester, it may be a little difficult to sleep as they may have vomiting, but also as our body gets tired, you should have enough sleep. That's around 8 to 10 hours in the night and 1 to 2 hours, because though the abdomen is not so much grown, but most of the organs the baby develops during the first 3 months. So the first 3 months we need to sleep well, because our body's relaxation takes place only at that part of the time. And what is the best position to sleep during pregnancy? So the best position to sleep during pregnancy, we usually advise the patients to sleep in the left lateral, that is the left side. Why do we ask them to sleep in the left side is the blood supply, that is the blood increases to the fetus and the uterus is more when they sleep during the left side. Why not the right side? So right side, because we have some organs, for example we have the liver there, so we ask them to sleep in the left side. If they sleep directly in the back, during pregnancy as the uterus starts growing, it starts pressing on important structure called inferior vena cava. That is one structure which carries the blood to the heart. So once it starts pressing, the blood flow to the heart, and from the heart it has to go to all the organs. So that blood supply starts reducing. That's why usually the patient is told not to sleep flat, either in the front or the back. That's the prone position, because we don't want to press the uterus and the fetus when you sleep in the prone position, or flat, we don't want the blood flow to be reduced. So when this blood flow reduces, what happens is the blood pressure reduces. So that's when you might have a little bit of giddiness. So always it's better to sleep in the left side. So when you sleep in the left side, you can fold your legs. When you fold your legs, it's comfortable to keep a pillow in between both the legs, so you can feel comfortable. And it's not a problem if you just during your sleep, if you by mistake you sleep in flat position for one day, there's nothing to be worried, but you might start feeling uncomfortable. So automatically you will get used to sleeping in the left side. Also, there might be disturbances during sleep. What causes these disturbances during sleep in pregnancy? You will start feeling the urination more. Usually you will pass urine maybe 2 to 3 times in the night. Here it will be multiple times, because the uterus is pressing the bladder, so you want to get up multiple times. Then you might have any chest discomfort or any heartburn during pregnancy is more common, so that might be disturbing. Sometimes because the blood volume increases, you start feeling your own heartbeat. We call that palpitation. And sometimes there might be shortness of breath. Since the uterus starts increasing towards the chest, you might feel a shortness of breath. Sometimes just the fear of pregnancy, is my baby moving? So how are we going to manage delivery? So these are some disturbing factors. So how can you reduce these disturbing factors? How can we improve the sleep? One is with this position, because the blood flow increases, so normally you feel much better. And also all these precipitating factors. For example, you can eat a little bit earlier. You're going to bed at 9 o'clock. You can eat at, for example, 2 hours before you sleep. So that your heartburn and chest pain might reduce. And you can have some light exercise, so that will increase your mood and you feel more happy, and also at the same time you feel a little tired, so you can sleep better. Yoga and meditation can help you relax, calm down your mind, and also some breathing techniques, so you can control your breathing, you can watch your breathing, so that will help. So, and all the precipitating factors, anything which increases, any oily food or any spicy food, especially in the night, it has to be avoided. If you wish, you can have them during the day when you're more active, and you can also have small nap in the afternoon, so that also helps you. So this is about sleep in pregnancy.
Yeah, in that I would like to add up unwanted seeing the cell phone or your TV, especially which is scary. Whatever you put in that goes to the mind. So you must be so serene. So the best advice, now switch off your cell phone 1 or 2 hours earlier. And don't see TV unnecessarily. If at all you see a good one. Not which is traumatizing, not putting a thriller, crime and all that, because that comes in dreams. And as told by Dr. Sridevi, the prayer, meditation, and auto-suggestion, that's a very great help. It's called self-hypnosis, affirmation, visualization. And if you're not at all getting sleep, don't try to lie down. You just get and start reading. Many people when start reading, they go to sleep. And your bed has to be beautiful. Whichever makes you sleep. And your quilt, your pillow, it's all small things. You keep it, and sometimes lavender aroma, if you're not allergic to that, that also helps. And if you're not allergic, don't use it. So make it like a flowers, keep some flowers. So make aesthetic, because your life, and sleep is mandatory. 8 hours minimum in the night, 2 hours in the afternoon. And quality sleep. And quality sleep is very essential. When you sleep, you have a repercussion. Your body functions very well. And you don't do much of a sin also. So sleep is very mandatory. And these are some of the breathing, as you told, breathing technique is very essential. Take a inhalation, exhalation more. Inhale 4 hits, exhalation 6 or 7. Exhale more, because carbon dioxide accumulates, that puts your brain into sleep. These are some of the methodologies to sleep. And thank you very much, Dr. Sridevi.
Thank you.